So I'm going to talk today about 3D printing and reconstructive surgery. I'm from Basel, Switzerland. Basel, it's comparable to Pech. We have around 170,000 residents. It's a beautiful city with also an old university, a lot of arts, and of course also a quite big university hospital with different clinics and research facilities where we are able to perform our research. And I'm from the Department of Maxillofacial Surgery. I'm there a consultant, and I'm also the head of the medical additive manufacturing group. We have a new founded, just opened department which is called Department of Biomedical Engineering, and there is my group located. And we are working in a quite innovative field with different research teams in different areas of biomedical engineering, for example, in biomechanics, tissue engineering, image-guided therapy, image analysis, whatever. But I'm not sure, I think most of you do not know what oral maxillofacial surgery is at all. So we take care of the patients from in the area of the face, and we're working, for example, together with patients that have facial trauma cases, that have cancer in the facial area. But we're also dentists. In the German-speaking countries, you have to be a dentist and medical doctor to become a maxillofacial surgeon. And there we have also quite a lot of complicated cases where we use imaging technologies. So why 3D? When you imagine, for example, a severe car accident, sometimes it happens. Fortunately, not often, but sometimes it happens that the patient will come to us with that kind of injury, which is a multi-fragment fractured facial skull. And we as surgeons, we have to deal with that kind of injury and have to reconstruct it. Usually we use titanium plates that we bend. We take the bones, bring them in the right position, and then we put the bones together with titanium plates, and as you can imagine, it's a quite challenging way of working, because we also have to use very small approaches. We're operating in the face, so we cannot open it completely and put on the plates, so we have very small approaches. And when you see here, for example, a conventional two-dimensional X-ray, you can also imagine that it's very difficult to see where the injury is and where the plate is exactly located and how you have to put it in the right position. So that's, I think, one cause why we use three-dimensional images. And even in CT, computer tomography, it's not that easy to see or to interpret the anatomy correctly. Here's a coronary slide where you can see the eyes and the maxillary sinuses, the teeth, and so on. But still, the information is not the same like here, for example, a three-dimensional image of the skull with a severe facial trauma, where we did the reconstruction of the facial injuries by titanium plates. And those images are, of course, they're virtual. Not, we cannot touch the skull by our hands. We cannot use it. So that's the cause why rapid prototyping technologies have been introduced to craniomaxillofacial surgery. Here you see one of the first models, how they produce 3D anatomical models by milling out of a block of styrofoam. It's a foam plastic block where the anatomy is being milled out. Or here you see a very early stereolithographic model of a patient's skull. And it was in the late 80s, so the time has passed, and now we have, of course, much more develop technologies to reproduce the anatomy of the patient. Here you can see, for example, a patient where we reconstruct this part of the skull by a patient-specific implant. So, but how do you get those 3D models out of a CT scan? Usually we use CT or MRI scans or cone beam CT, and we have two-dimensional slides, cross-sectional slides, images that are going, and you've already heard it, are going to be segmented in a process which is called segmentation in a 3D model. And with this model you already can work at the computer and you can perform, for example, like virtual surgery. Without touching the patient at the computer, you can plan and, for example, plan patient-specific implants. And the next step is the export, the slicing and the export of the model, and of course the printout, which you can see. What is very important, that is the segmentation and the differentiation of the different tissue qualities or tissue densities in the segmentation process. Here you can see, for example, the bone, and you see muscles and different other tissues that you've seen this before in the lecture. They can be used as the basement for reconstructing the 3D image. And here, for example, some 3D printouts we use at our clinic for planning surgical procedures, and of course also for education. That is also a quite interesting field of 3D printing in medicine. Patient with a huge tumor that had to be removed, or here another patient with a huge tumor where we reconstructed the right part of the maxilla of the midface and the floor of the orbit by titanium mesh. Or here a patient before an operation, after a trauma, the mandible is fractured, and here after the operation. And where we're also doing some research is using consumer printers in medicine, because we think you do not necessarily need a printer that costs 100,000 euros to print out anatomical models. So we have, for example, a master student that printed out 3D models and scanned them with a 3D scanner and compared the different models. And we found out that the consumer printers, they are quite reliable and the accuracy is very good. So we are in a sub-millimeter area, and so we can also use those kind of models for preoperative planning, for example. Now I'm going to present some cases. Here, for example, patient with an oral cancer. The cancer has to be removed completely to heal the patient, otherwise it will regrow. And here we already have a 3D model of the mandible that has been reconstructed by the CT scan. And what you can see here is a titanium plate that has been pre-bent before the operation, so that we will not lose any time during operation to bend this titanium plate, which takes around 30 minutes usually. So we will save a lot of time, and also we can use those models, of course, for planning the operation properly. Another way of reconstruction, of course, you can remove just the tumor and reconstruct it, but we also use the reconstruction by spare parts out of the bone. For example, we use the fibula for reconstruction of the mandible defect area. The fibula is a bone that can be transplanted. It's from the leg to the mandible, and can replace this defect zone. You do not need this bone normally in your daily life. Only if you're like a runner, or you have a very active sportsman, then you maybe will miss it, but usually you do not need it. And it's a perfect way for reconstruction. Here another case, it's a very usual or daily business in our clinic. It's a fracture of the zygomatic bone. And here a colleague, a resident at our clinic, he's pre-bending the titanium plates for reconstruction. Here you can also see the educational aspect of this 3D printing in medicine, because usually that bending has to be done during the operation, which will take time, of course. Every minute in the operation room is very expensive. The patient has a longer anesthesia time. So here you can sit in your office and work with those models to plan. And it's before the operation. You do not need to open the patient to have those models. It's just the patient is untouched and we can plan the reconstruction. What you can see here is the fractures on the other side. We use this very easy or very simple mirroring technique. So we mirror the healthy side on the injured side on the other side and the healthy side on the side where we operate. So the plates will be in the correct position. Yeah, that's one wave of reconstruction. That is the way of mirroring and using the symmetry of the patient. Of course, it's not always 100% exact, but you can adapt the plates, of course, during the operation, but it will save a lot of time. Another thing, reconstruction of orbital floor defects. When you get a hit on the eye, or you have an accident, or play tennis and you get the ball in the eye, then you have often an orbital floor defect. We use plain titanium meshes for reconstruction, and it's quite difficult because the approach below the eye is very small, and you can imagine that it's difficult to get in those meshes through the small approaches and adapt it correctly. So we adapt it before. We print out the orbital model and adapt the plates. And this is a post-operative cone beam CT reconstruction, three-dimensional, and the result is a perfect reconstruction of the patient anatomy. So we save quality, time and cost with 3D printing, of course. And there are many other indications where you can use those 3D models. Here, for example, for planning orthognathic surgery, moving the maxilla and the mandible after sawing them in a special way and in combination with a stereolithographic model. That is a patient I operated last week. He has a large tumor of the maxillary sinus and the paranasal sinuses. And I pre-bent this titanium mesh with a very complex geometry, and we used PEEK, which is a medical plastic, for reconstruction of this defect area. PEEK is not being printed until now, but you can, but it's quite expensive at the moment. But you can mill it out of a block. And this is the image after reconstruction. The PEEK cannot be seen because it's radio translucent, but you see here the titanium mesh on the plates. And there are many other indications. For example, here you see again a 3D bent titanium plate, and here the intraoperative view. The plates fit perfectly. This is after operation. You see the plate, and here you see the fracture. We reduced the fracture before the operation at the model, and we pre-bent the plates, and we use this after operation. Here another case. See this plate, and I will skip this, and you see here after the perfect alignment of the plates. What we also do in our research center in collaboration with the University of Applied Sciences is 3D printing of titanium. And this is one of the, I would say, next steps, what we already use. So we already treat our patients with that kind of implants It is, for example, the design and printout of three-dimensional patient-specific osteosynthesis plates that are also used to fix the bone, but they're perfectly fitting. You do not have to bend it. It's perfectly fitting because it's designed on the patient anatomy. Or you can use for replacement of certain bony parts of the body, you can use titanium parts. Or here, for example, 3D printed titanium plates that can be used for reconstruction of defect areas. And our next step, that's quite sure, and is of course the bioprinting. We're already able to print out scaffolds, but what we want to do, that are, for example, the kind of scaffolds, for example, in hydroxyapatite, what we want to do is, of course, work together with the tissue engineering labs to get life in those scaffolds, to be able to replace, as you were able to see here, areas that had to be resected or removed out of the human body to enable new growth of bone in this area. So to conclude, I think rapid prototyping in medicine, or especially in surgery, is it's just perfect. We use it in our clinical life every day. The patient-specific care is, of course, the future of medicine, quite sure. What we also use, and what is, of course, makes sense, because not every group has hundreds of thousands of euros to buy expensive printers, is to buy even small departments, cheaper printers, to use them for medical modeling. We have a higher patient safety. The operations will take not that long as they usually were taken. For example, only if you can save around half an hour time, it will be less than 1,000 euros of cost for the patient or for the health insurance companies. And what we also promote is the printing in-house. We are going to establish a printing lab facility in our clinic, and I think that will be also something that will be very, very interesting for the future, to be able to print directly in the clinics, not to be dependent on companies outside. So we are always interested in cooperations and to exchange our knowledge and to build up new collaborations. So you're welcome to come to me and talk about different topics. And I would like to thank you, of course, for your kind attention, and have a nice day.
Yeah, I would like to ask, is there a guideline which says where it's better to use PEEK instead of 3D printed titanium custom implant?
Well, guideline, I don't know, official guideline. For example, it depends on the area of reconstruction. For example, if you want to reconstruct a part of the skull, which has not that biomechanical impact, like, for example, a long bone, then PEEK is a very good kind of solution. I think one disadvantage of titanium is that it's still quite heavy, but with 3D printing, before that they milled it, but with 3D printing you're also able to print out very complex geometries that are very light. They don't have a lot of weight, so it's not a problem at all. But I think it depends on the area what you want to reconstruct. For example, for the mandible, at the moment titanium is the material of choice. But for a skull reconstruction, I would use PEEK. Yeah.
And is the PEEK osteoconductive as the titanium, or you need to make custom implants with the connection points of the PEEK?
That's also a good question. The PEEK is a kind of osteoconductive, yes. They also did some studies with dental implants, and it worked quite well. And there are different histopathological examinations where they had shown that the bone is reacting with the PEEK on a comparable way like titanium. But it depends on the surface of the PEEK, of course. A lot of implants, they're very, very smooth, and they don't have this complex surface at the moment, which is, I think, a problem of the production. But the printing of PEEK will give us the benefit of produce also that kind of surface.
And do you know if someone is experimenting with 3D printing of the PEEK itself?
Yeah, we are doing we are doing that, and there are some groups, of course. It's very interesting because it's cheaper and it's affordable for smaller groups, and PEEK is a very interesting material. Yeah.
Thank you.
You mentioned the tissue engineering.
Yeah.
The application of tissue engineering. How far it is to really be applied in medical research? Because if somebody comes in with a tissue engineering and they generate the form for a specific person,
Yeah, there are a lot of groups that are doing research in this area. And we have, for example, in Basel, Eva Martin, the tissue engineering group. They're very strong, and they're doing research in 3D scaffolds. But I think it's cadaver bone that they want to where they want to cultivate cells, that kind of. Together with vessels, for example, to use this later on maybe in the patient. But my goal would be to print a kind of scaffold, as you already said also, this way of printing and putting cells on it, because I think it would be quite difficult to get the strength in a 3D model that is compound or like a composite whatever graft made out of cells, bone-like structure, and whatever. But I think that will be the future, of course. Yeah. Okay. Pardon?
You have shown some plates with like Italian.
Yeah.
Plates. Use laser melting or laser sintering? You start from powders or you melt?
It's a powder.
So you sinter,
It's a melting.
Yeah.
Melting.
It's melting. That's
Yeah.
sinterization. Okay.
It's a melting technology.
And just again another question. I need the same technique used for PEEK, because for PEEK you must reach to 70 to 80 degrees. Is the same technique used for PEEK?
PEEK will need more like...
Yeah, the problem with PEEK, that example, you must reach to at least 270, probably 80 degrees.
Exactly.
So using the same kind of technique for PEEK. Which technique used for PEEK?
Well, at the moment it's milling, because it's very difficult to print PEEK. The PEEK, it's a powder, you can melt it, but the problem is you have a huge waste of material. You have this powder bed, it has to be heated up to, I don't know, 320 degrees, and then you will print with 380 or whatever you said, a very high temperature, and all the material has to be thrown away after your printing process. So there are only, I think, 2 companies that will print PEEK with the laser melting technology, and it's very expensive, and they're collecting models. So you have to wait for weeks until you will get your model. That's not for us a solution. We want, when the patient will come, the ideal way of treatment will be the patient will come, we have a CT scan, we will reconstruct or segmentate, we will plan the implant size, and then we start printing immediately. And that will take maybe 12 hours or 10 hours or 15 hours or whatever, depending on the geometry. And this is, I think, something very interesting at the moment. There are some groups doing research in this area. It's fused filament fabrication or fused deposition. Yeah?